Good evening and welcome to Scotch Plains Library presentation. My name is Mary Beth Fisher, and tonight we have with us Shalini Rajput. She is an assister with the New Jersey Citizen Action Education Fund. She's going to share with us some very important information about the special enrollment period for healthcare. So thanks very much for being here. Go right ahead.
Thank you, Ms. Fisher. Good evening and welcome everyone to this very informative session. I'm Shalini Rajput from New Jersey Citizen Action, and today I will be talking about healthcare. So usually what I do is first I provide the information, and at the end of session I will try to answer any questions you have. Ms. Fisher also mentioned that she's going to put this video on YouTube. So once you watch the video, if you have any questions, feel free to write in the comments for the library, and Ms. Fisher will definitely let me know or let you know my contact, and I would be happy to answer any questions further onwards. So without any further delay, let's start. And I'm going to share my screen with you. Ms. Fisher, can we see my screen?
Yes.
Thank you. So today we're going to talk about ACA Special Enrollment. ACA is an abbreviation of Affordable Care Act. I will talk more about it to make it more clear. Before I start my presentation, I just want to let everybody know that the work we are doing is based on the grant provided by State of New Jersey Department of Banking and Insurance. All the findings and information that I'm sharing today is sole responsibility of me and my team. No interpretation is not necessary to reflect the views of federal, state, or local government. So just a little bit of my organization as well. Who is New Jersey Citizen Action? New Jersey Citizen Action is a statewide grassroots organization that fights for economic and social justice. We use a combination of policy work to empower low and moderate income people. We provide few free services, actually a lot of free services. Some of them are healthcare enrollment assistance, tax preparation, financial coaching, first-time homebuyer counseling, and a lot more. I strongly suggest please go online and look for njcaef.org. The link in the link below. You can follow us on Twitter and Facebook as well. There is a lot of help provided. It's all free. Please make sure to look us online. Now, what is Affordable Care Act? Affordable Care Act makes health insurance available to more people. The law provides consumer with subsidies, which is called premium tax credit, that lowers the cost for household with income between 100% and 400% of federal poverty level. To make it simple, I'm going to share this small screen. So just to say, if a number of household is 1, the federal poverty level, 100% for federal poverty level will be around 12,880. The higher limit, 400%, would be 51,550. If you fall in this range, you will most likely be able to receive benefit in terms of premium tax credit from federal as well as from state of New Jersey. So honestly, it helps a lot towards paying premium of your insurance. What other ACA does? It expands the Medicaid program to cover all adults with income below 138% of federal poverty level. So Medicaid program was earlier not able to support all adults under 138, but expanded Medicaid, which is in few states, and we are lucky that state of New Jersey has expanded that program. So adults which were not covered before are also covered. It provides support initiative to medical care delivery methods designed to lower the cost of healthcare in general. Now, to enroll on ACA or Affordable Care Act, which is also known as Get Covered New Jersey. There are certain dates to keep in mind while enrolling. Normally, the open enrollment starts from November 1st to January 31st. So this year it will start in November 1st, 2021, and it will go on to January 31st, 2022. Right now, because of the very special situation we are all in, COVID, State of New Jersey has extended the deadline of enrolling from February 1st, 2021, which is open until December 31st, 2021. I will talk more about it to make you understand that what it is. There is another kind of special enrollment which is available from February 1st, 2021 to October 31st, 2021. That comes in consideration when there is a special event happening in our life, like a child is born, you got married, if you moved to New Jersey recently, and many more. Again, I will talk about them in my coming slides. So Affordable Care Act, what does it cover and how does it help apart from other insurance? I want to say again and again, Affordable Care Act is the insurance being provided by the state of New Jersey. It is on the marketplace and we can buy it for a much lesser premium than I'm going to say other providers. So it covers people with pre-existing health condition, including pregnancy, without charging anything extra. So if anybody has any pre-existing condition, the premium of the insurance, the cost of insurance will not go high for them. It provides free preventative services. Services like our well visit to the doctor, cancer screening, well woman visit, and many more are free of cost under ACA. It gives young adult more coverage options. It ends lifetime and yearly dollar limit on coverage of essential health benefit. What that means is that your insurance company cannot put a cap on how much they are going to cover you for the year. Even if your cost is coming out to be thousands of dollars, they cannot say that you are not covered. Holds insurance companies accountable for rates increases. Once you're signed up, once you have a certain rate, insurance company cannot increase your rate, basically your premium. It is illegal for health insurance companies to cancel your health coverage just because you get sick. You signed up today, maybe in a few down the line, few months, should not happen, but just in case you are diagnosed with any health condition, your health insurance company cannot cancel your coverage. It protects your choice of doctors. If you already have a certain doctor that you visit to, most likely you can find the same doctor under ACA as well, and you can keep your doctor under the ACA plan. It protects you from employer retaliation. So what is healthcare insurance? We're talking about insurance and what it is actually. Health insurance, first of all, is much different than life insurance. It is to take care of your health for one particular year, and it provides you many more benefits. What they are? It's a way to pay for healthcare services like doctor's visit when we go to doctor's office, hospital service, if in case we need to visit hospital, prescriptions, your medicines, lab test like X-ray, blood work, CT scan. It also helps for the care that help prevent illness. We are absolutely fit individual. We do not have any sickness. So we say, why do I need any healthcare? Why do I need any insurance? Because you want to stay like that. You do not want any surprises coming all of a sudden. In order to stay fit, in order to maintain your health, we need to have certain preventive checkups done. Such things like cancer screening, well woman visit, blood pressure screening, diabetic screening, and our yearly exam, flu shots. These things keeps us a check that we are doing everything is fine with us, nothing is wrong. And in case anything is starting to get wrong, if it is checked on time, we can make sure that we can take care of it. Just to give you an example, so the health insurance protects you from having to pay the full cost of care. If you do not have a health insurance, so you might end up paying much more if you have to go to a doctor. Let's say I have a fever, I do not have insurance, and I have to see a doctor because I'm not well. If I do not have insurance, my cost will be much more versus if I have insurance. Just like our insurance, you choose a health plan and pay a premium each month for health insurance. And in case we need it, that a small premium will come a long way in helping us, and it saves our wallet. Now just think of it. We buy a car, we buy a house, immediately we buy insurance, even if we do not use it. And we keep on renewing definitely every year, because we know sometimes if we need it, it's going to help us in a long time, and it's going to be less burden on our pocket, on our wallet. Similarly, healthcare insurance, even if we are not sick, even if we are not visiting doctor every month, which we should not, we keep the insurance to make sure that in case we need to use those facility, the burden on our wallet will be much less. In fact, there would be no burden. So the plan pays for your care. And how much does the plan pay? It depends on which plan you choose and what kind of plan you decide to take. So take charge of your health. Now, to understand healthcare, you need to answer a few questions before you go and start buying for the insurance. You need to ask yourself, why do I need health insurance? What's my need? Why is it important? Just like I said, it is important. So you should understand it is important. Then only you will have that feeling, that urge to really go and get the insurance. What do I need and what do I want? What's my requirement? Am I going to visit my doctor for my pre-existing condition more often? Or I'm just making sure that everything is in place and I'm just going to use my insurance for preventive checkups? What are my choices? So before you buy, look for each and every plan, look for each and every provider and see that what fits your needs perfectly. How much will it cost? You know your need, you know what the plan is offering. Now, how much will it cost me? Costing, a lot of things matters in costing, like your copay, like your deductible, how much is out of pocket, and how much is your co-insurance coming out to be. And most important thing, how much can I afford? So what I suggest is make a budget before you start buying for the insurance. So make a budget, keep your routine requirement, your monthly requirement separate. This much I'm going to spend my grocery, this much is my standard amount that I'm going to spend, and this much I can afford to keep aside for my insurance premium, because premium will be monthly. Although with ACA it comes out to be much less, but we have to make sure that we have that money kept aside. So why is having health insurance important? Like I keep on saying this again and again because this is important, and this is important to understand. We are healthy individual, everything is going fine, everything is absolutely perfect. We are in utopia world. Emergencies can happen anytime. I'm walking today and I can slip and I can have a sprain in my ankle, or worse, I can break my bone. I have to go see a doctor. If I do not have insurance, it's going to be a big burden on my pocket. But if I do, I'm going to say, okay, I have insurance, I am covered. I'm just going to see a doctor and doctor will take care of me. And I will make sure that I will follow everything that my doctor advises. I have seen this, that sometimes people don't have insurance and they avoid taking care of their health. They avoid going to doctor, they avoid going to preventive services because it's definitely going to cost more. So we will avoid those hesitation once we have the insurance. It makes care affordable. Once you have the insurance, all your care is affordable. Everything that would come out otherwise costly will come out much less. Um, I was reading this article which said that all the insurance companies have a contracted rate with the doctor's office for each and every services that they provide. So, so every service that is provided at the doctor's place, once insurance is covering it, almost the cost of it goes half. Even if you have not met a deductible, even if you have to pay it from your pocket, it will be absolutely half versus what you would pay by not having insurance. So there is one reason. Seeing the doctor for basic care can add up fast. We have flu, we have fever, we have headache, go to a doctor, and small things adds up a lot. Preventive care services, your flu shot, your yearly checkup, these are all covered by health plan, so there is no cost to it. So we can easily go and just get it done. Just to give an example, few services like flu shot. So I have two columns. So one is cost without insurance, one is cost with insurance. Insurance with AC, I would say. Flu shot without insurance will cost. With AC insurance, 0. Screening for diabetes from 1 to 25 to 200. With AC insurance, 0. Annual well visit, somewhere around $160. With ACA, nothing. HPV vaccine for kids, which is usually given twice, will be around 450. 250, I'm sorry. With insurance, no charge. So approximately the total cost come out to be without insurance for these preventive checkups is around about $1,000, right? With AC insurance, nothing. You're covered for all of this. And this is just an example. There are many more apart from these services that are considered preventative, and they are available to you without any cost. So hopefully that gives some of motivation. Shared responsibility payment. I want to share this information with you. So before 2019, everybody was, it was mandatory for everyone to have insurance, especially in the state of New Jersey. Failing to have no insurance, we were supposed to pay a shared responsibility, which is a kind of fees, I would say, or a kind of fine, I would say, for not having insurance. Due to COVID and due to special circumstances, state of New Jersey has put a comma on this, but this might come back, and having insurance is important. It might be mandatory. It used to be mandatory until 2019. So everybody who had filed for taxes before 2018 had to have insurance. Otherwise, there was a penalty for while doing taxes. Now, when can I enroll? Like I said, the COVID-19 special enrollment is currently available from February 1st to 2021 to December 31st, 2021. Special enrollment in case of any special event happening in the life is available from February 1st, 2021 to October 31st, 2021. After that, there will be an open enrollment from November 1st. So anybody who has not enrolled or anybody who has enrolled but need to enroll for next year will be enrolling during the open enrollment. Just a few dates, coverage, when the coverage will be effective. If you enroll by if you enroll by mid of any month, the coverage will be effective by 1st of next month. Just for example, since we are in April, if you enroll any day by April 30th, the coverage will be effective from May 1st. Enroll by May 15th, the coverage will be effective from June 1st, and so on. What is COVID-19 special enrollment? I keep on saying this word, so you might be thinking what it is and do I have to be affected by COVID? No, it is you are eligible if you are an uninsured resident in New Jersey. If you are in New Jersey, you are residing in New Jersey, and you do not have any insurance, you can still enroll for COVID-19 special enrollment for ACA marketplace. Uninsured dependents residing in New Jersey. Why I focus on dependent? You can be dependent on somebody. That person can have a coverage through their job or anywhere else. But if you do not have coverage, you can still enroll on COVID-19 special enrollment for ACA. If you want to change your plan, you can. If you already have an insurance with ACA and you want to change your plan, you can definitely do it with special enrollment. You do not have to be affected by COVID-19 directly. There is no document required for this special enrollment. Other special enrollment period, like I said, this is a period where if you have a special event happening in your life. This year it is coinciding with COVID-19, but usually special enrollment and open enrollment are two different entities. But this year we have COVID-19 as well. So qualifying life event for special enrollment is loss of job, change of income, change in immigration status or citizenship, death of a spouse, just married or divorced, birth, adoption of a child, moving to New Jersey. You are no longer eligible for NJ family care. And the biggest and the very new is pregnancy. If somebody does not have an insurance and they get pregnant, they can still apply for insurance through ACA. This is a very special event, and this is very new added to ACA special enrollment period. Important information. Please do not miss the deadline. For the special event, you need to enroll within 60 days of the major event that happened, which excludes pregnancy, income change, and death. You can inform about these events within 60 days, but you can ask for a coverage as a retroactive from the date of happening of the event. So the insurance options that state of New Jersey is providing, one is NJ Family Care. Most of us know it as Medicaid program. Medicaid program is a free or low cost health insurance forum. It is available for children from age 0 to 19, mostly known as CHIP program. Adults 19 to 64, known as Medicaid, and for disabled citizens of New Jersey. I'm saying citizens of New Jersey, but you can be a citizen or you can have a green card for 5 years and reside in New Jersey to be eligible for NJ Family Care. Now, you say, if I am not eligible for NJ Family Care, what options do I have? State of New Jersey is providing a marketplace state insurance option on GetCovered New Jersey. Most of us know healthcare.gov or Obamacare as a federal program for insurance. GetCovered New Jersey is the state version of healthcare.gov. So basically, state of New Jersey has adopted healthcare.gov as its own. So people living in New Jersey who were enrolled in healthcare.gov are now need to migrate on GetCovered New Jersey or marketplace. You can apply for healthcare insurance at GetCovered New Jersey. You can get financial help to pay for the premium. No extra cost to have an assister assist you. You can ask for an free assister to apply for GetCovered New Jersey. They can help you fill the application. They can answer your questions. You may have plenty of questions in mind. Feel free to ask. Feel free to make any number of calls. There is no charge. Nobody's going to pursue you to buy a certain kind of plan or not buy a certain kind of plan. It is just simply to assist you. The website is GetCoveredNJ. Three major providers for GetCoveredNJ is Horizon, Emory Health, and Oscar. The coverage is pretty great. Almost every doctor and every place is covered. I strongly recommend, please go and check your options. Please go online. So learn what your benefits are and how to use them. Now you know what the importance of healthcare is. Now you know how to buy it. Now you know where to get it from. Now you learn what your benefits are. So what does health insurance cover? Outpatient or ambulatory cover, simply known as visit to your doctor's office or clinic, or same-day surgery center. Emergency services, trip to ER, or ambulance transportation. Inpatient care, a treatment that we receive while admitting to the hospital. Maternity and newborn care, care while giving birth, during pregnancy, and for a new baby and new mom. Pediatric services, care for babies and children, including dental and vision. Mental health and substance services, it's inpatient and outpatient treatment such as counseling, detox, or addiction recovery. So these are few words that you often encounter when you are looking at your insurance benefits. Sometimes we don't understand. So these are just a small examples. Still, if you need more help, you can definitely call the assistant anytime. Few more words. Prescription drug coverage. Pays for medicines the doctor prescribe you. Rehabilitative services. Services that we need to recover after an accident or illness. If I slip, if I break my ankle, or if I break my knee, and I need help in getting back on my feet, I would use rehabilitative services. Habilitative services. Services or device we need to help function if you're disabled in some way, like crutches. Lab services. Test, diagnostic, like blood test, x-rays, CT scan. Preventative services. Like I mentioned earlier, your yearly physical, screening and immunization, flu shots, program to help manage chronic disease like asthma, diabetes, cancer screening, well-woman visit. I can go so on. A little bit of more health insurance language. I don't want to bore you, but this is something important and I think you should know about it. Premium. What is the premium? Is the amount that you pay monthly after monthly for your health insurance. So just like I said, you pay car insurance premium. Similarly, you will pay a few certain amount per month towards your premium. Deductible, amount that you must pay before the health plan begins to pay for your services. There are some exceptions to deductible. You do not have to meet your deductible to take benefit of your preventative services. There are more. Please go and check online, and you will have a better idea. I just have less of space, so I couldn't put everything over here. Co-payment, a set fee you pay every time you see the doctor. On your insurance card, you will see this mention how much co-payment you have to pay for your PCP as well as for your specialist doctor. Sometimes it is around $25, sometimes $30, sometimes $10. It varies as per your plan. Again, co-insurance, it's usually a percentage of the cost you pay for the care after you meet your deductible. Like some insurance take, you hear it, this plan is 90-10. That 90-10 is your co-insurance. That means insurance will pay 90%, you will pay 10%. Sometimes it is 75-25. 75% will be paid by insurance, 25% will be paid by you. This is what your insurance card looks like. A would be this would be a member name. There will be a pre-authorization. What kind of insurance you have? You have PPO, HMO, or EPO. Your primary care provider's information. And this is what I was telling. Primary care physician, how much is the copay you have to pay for primary care, for specialist visit, for urgent care and emergency room. Some cards have all the information, some cards have few of them. What is your prescription benefit is, like things like that. On the back of a card, you will have information to contact your provider. Now, you need to know what your plan will pay for. In network, doctors or office, the health plan have a contracted rate. So if the doctor's office is in network, your plan will pay a certain amount towards your services provided. Out of network, the doctors or office, your health plan does not have a contract to provide health services. So we strongly recommend to check and see before going to doctor that this doctor is in network of your plan, rather than getting a surprise and ending up paying a lot. Then you would have to if you go in network plan. What is a referral? Most health plans require a written letter from a doctor giving you permission to see a specialist. If you need to see a specialist, insurance plan will ask a referral from your primary physician that you need the service and you need to go to a specialist. Now, you have health insurance, you have your card, you have all the information. It's time that you have to visit the doctor. How will you find a doctor? There are a number of ways that you can find a physician or a doctor that you need to visit for your need. You can call your health insurance company, tell them what you need to go for, and they can give you multiple options, most likely closest to your residence. Check the health insurance website. On the back of your card, you will have the information of the website as well. You can go online and check which doctor is residing in your area and which doctor is you can visit. It has to be in network. Please make sure it is in network doctor. Call the doctor you want to see. Your neighbor has gone to a doctor, they recommend them very well, they say this doctor is very good, please go to it. You see, oh, my insurance also have this, you and I have the same insurance, definitely I can go. Before going, please check with the doctor that you're going to. There can be a slight difference in the network and your doctor may or may not be in network. I keep on saying in network because it is very, very important to see a doctor or any facility in network of your plan to get the maximum benefit of the insurance. What is a PCP? A primary care provider. With most plans, you can choose a primary care doctor you want to see for your care. So you can designate a doctor who would be your primary care doctor, and you will go to them for basic requirements of your health needs. If you have any special requirement, your PCP can provide you referral to go to a specialist. They will have a very fair idea which specialist will be in the network and which a specialist is able to best fit your needs. Specialist, like I said, a doctor who focuses in one particular area like cardiologist, neurologist, and so on. Again, please check that the doctor you are visiting is in network of your plan. Remember, few things to remember. Maintain your health and obtain health insurance. Go on Get Covered New Jersey. State of New Jersey is providing a lot of benefit, a lot of help. I strongly recommend please go online and check. You do not have to buy just because you're filling up a form. It's always good to check. Visit your doctor for primary care for non-emergency visits. Why I say so? Because sometimes visiting a specialist for not very specific reason can cost you more than visiting a primary doctor. So why to waste? Go to emergency room only for emergencies. Visit your doctor for everything else. Just like I said, emergency rooms can cost you slightly more than the primary care doctor. So better go to primary care doctor for things that they can handle. Again, to keep less weight on your wallet. How, if you need to contact us for ACA enrollment, we provide free help for ACA enrollment. We are certified assisted by state of New Jersey. We can take your call or you can email us. The email is down. I have provided my number as well, 973-745-8307 if you directly want to get in touch with me, or you can leave a number on our hotline 1-888-654-3893. One of us will get back to you once you leave a voicemail, and we will definitely try our best to help you out. I will leave this slide on for a few minutes so that if you need to note the number and information, please feel free so. Again, I strongly recommend to either go online on Get Covered New Jersey and look for your options. If you need help in understanding something, if you have any questions, even before checking online, if you have any questions, whether I qualify, what do I do, get in touch with us. We are very happy to help you. Just to add a few things, New Jersey Citizen Action is providing a lot more help than ACA enrollment only, like housing, rental and foreclosure, financial coaching, healthcare enrollment, what we are doing, tax preparation, housing discrimination, and just CS oil group. I'm leaving the slide on for a few more minutes in case you need to note down the numbers. Every number and email is on the slide. And I strongly suggest please go online and check NJ Citizen Action. There is a lot and lots of help available for free of cost. Just use us. And with that note, any questions, I would be happy to answer. And if you have any questions after the YouTube video, you can definitely post it on the remark, and Scotch Plain Library will be in touch with me.
Thank you so much. I think that was a really great comprehensive overview. One question did come to my mind. Is it still the case that anyone up to age 26 is eligible to be covered by their parents' insurance?
Yes.
Is that still okay? But anyone who's hitting 27, this is excellent information for them.
And just so you know, sometimes we think that because it is provided by state, help is only for citizens or those who have green card. For ACA enrollment, anybody who anybody with EAD or anybody even on H1 can apply. So I strongly suggest please go online, irrelevant of your citizenship or how you are, please check.
Wonderful. Thank you so much for doing this for us. I really, really am glad we were able to do this. So thank you for watching this video on YouTube once we get it up there. I want to encourage you to take a look at our website, www.scotland.org. You can check our wellness page for even more wellness and medical, health information. You can also scroll all the way down to the bottom of our webpage to sign up for our email newsletter. We have one specifically for adult events, and then you will always know what we have going on. We've got a lot of programs coming up in the spring and summer. So thank you again, Shalini, for doing this for us. I really, really appreciate it.
Thank you, Ms. Fisher, and thank you, Scotland Library, for having me on. Have a good night.